here. I wanted to talk today though about what I do, which is urogynecology, why it's important, and why it ties into menopause and perimenopause care. So I get asked by patients all the time, how did I end up going into urogynecology, right? I'm a relatively young physician. I'm still in my 30s. I talk to people about stuff that tends to happen more commonly in midlife and beyond. So most of my patients are in that demographic of either midlife, or especially I see a fair number of patients in that are elderly or older, more seasoned, I guess a lot of times they like to say. And the reason why I went into this specialty is because it's so awesome. There's conditions that women face every day that are so common and yet so swept under the rug, so shrouded in embarrassment, and a lot of it ties into their perception of self, their own well-being, as well as their relationships and their intimate relationships with their partners. So those conditions in my field are prolapse, incontinence, and pelvic pain or sexual health issues. So prolapse, first of all, is like a hernia, but it's in the pelvis. We see it often related to childbirth, but you don't have to necessarily have ever been pregnant to even get it, or to have had a vaginal delivery. It can still happen with a C-section. But the most common risk factors are having had a previous childbirth, as well as for being a female, and age. So we tend to see it more commonly in women, especially after menopause. Now, what does menopause have to do with all this? We think of estrogen often related to hot flashes because that's what it's FDA approved for when we think about hormone therapy today. However, estrogen plays a role in pretty much everything from head to toe with our bodies, and anyone who's gone through perimenopause or menopause and has had symptoms with that can tell you all about it. But when it comes to pelvic floor health, estrogen plays a role in our tissue quality. So the actual tissue quality changes with collagen and just structurally impacting connective tissues in our pelvis. It also impacts menopause, impacts our testosterone levels. Our ovaries produce testosterone and estrogen and progesterone. Testosterone plays a big role in our skeletal muscle and in our muscle volume, which actually decreases after the age of 30. There's this common stat that it decreases by 3% every year after the age of 30. That also impacts our pelvic floor. Those muscles, that connective tissue, that's what holds up our pelvic organs. It's kind of like a bowl or a butterfly, depending how you ask. There's this esoteric discussion in Urogyne about that. But regardless, there's this platform in our pelvis that holds everything up. So it's not the uterus holding everything up, it's this platform there, our pelvic floor. And so estrogen and all of our menopause-related hormones play a big role in that. And this is why I've gone on to do extra certification, not just in the procedures I do for prolapse, but also from the clinical side in hormone therapy. So I'm also certified by the Hormone Health Institute and by BioT for hormone therapy administration, which is also an integral part of our training as gynecologists, but I certainly learned a lot more doing those extra trainings. All right, so that's all about estrogen, menopause, prolapse. What about incontinence? Incontinence is actually probably the most common thing I see. So incontinence can either mean leaking of urine or loss of control of bowel. Now, for people who've never dealt with that, you're actually in the minority. So it's a very common issue, but the reason why that happens, again, is multifactorial, just like prolapse, but a lot of it ties into our pelvic floor health. What does menopause have to do with that? Estrogen, again, which decreases dramatically going through menopause, actually helps with our bladder microbiome, which is a relatively new concept. We used to think urine was sterile. Now we know that it has actually healthy bacteria, just like our gut can. So estrogen plays a big role in that. We already talked about estrogen playing a role in tissue quality. So when we see a combination of those changes for people going through perimenopause and menopause, we tend to see more issues with having to go to the bathroom frequently, leaking potentially with jumping or coughing, sneezing, other activity, sometimes leaking on the way to the bathroom, or problems with you think you went, but then you're dribbling, or, just all kinds of misfiring happening there. There's also kind of nerve connections that are involved in this process. And so along with all those issues, again, on the surgical side, I specialize in certain treatments, not just slings, but urethral bulking, bladder Botox, sacral neuromodulation, other specialty nerve stimulators for the bladder. But I also have that extra training from the clinical side, addressing that hormone health issue, which is also such an important component and really goes together with those procedural treatments. With both of those things, prolapse and incontinence, I work very closely with pelvic floor physical therapists. And they play a big role in helping people with a lot of the behavioral things that can help with that, strengthening or lengthening certain muscles that are important in these issues. And so again, it takes a team to deal with these issues. And again, I love it because treating these things makes such a big difference in quality of life. Again, if you can imagine with these things, I have elderly patients, and sometimes not so elderly, but people who are literally sitting on their bladders. So when people say, oh, is this just normal aging? Some of that's because they're hearing that from other doctors even, or from other people if they have talked to other people that, oh yeah, that just happens when you have kids. That's what happens when you get old. But you know what shouldn't happen when you get old? You shouldn't be living with health-related problems that are prohibiting you from achieving your healthy weight because you can't exercise because you're leaking everywhere, or impacting your social life because you can't go anywhere you feel like because you're worried about having access to a bathroom. So again, the things that I do are to treat common issues that affect women or other people who are born assigned female gender at birth, but common issues that really impact daily quality of life with treatments that are typically covered by insurance, rarely not, but typically covered by insurance, and can make a huge difference in helping people thrive with dignity across all the seasons of their life. So I hope that you guys enjoyed that little spiel about what I do, why I do it, why it ties into menopause care. I'm going to upload this to my business Facebook, and if you didn't have a chance to hear at the beginning, that's Essence Health and Urogynecology. The link is in my profile page, and I hope to see you there. Have a good day.